The whole journey started one fateful night when I was doing my monthly cell breast examination, when I saw a lump in my breast.
So I grew up with a mother who had cancer 4 times, including breast cancer. And as a result of the fact that she had breast cancer, I was very breast aware.
When I got to the government hospital, the waiting time, they gave me like 2 or 3 months or thereabouts to see a surgeon. Not even the surgery or anything, just to see a surgeon.
My ex-husband is a pastor, so it was like I should wipe away that, I should forget about that, I should pray that there's nothing God cannot do. But that burning sensation wasn't going. So that was what prompted me to run to the hospital.
I will never forget, it was very strange because I'd had a mammogram done, but something in my spirit said that something wasn't right. They told me that it was fine, but they didn't give me the CD. This was in Lagos, and they said it was fine and I should come back in 2 years, but there was something niggling me.
They did the biopsy, they removed some of the particles inside. So afterward, they told me that it was cancerous.
Over there, they're very straight. He just sat me down and said, look, I have good news, I have bad news, which one do you want? I said, just give me the bad news. He said, well, the bad news is you got breast cancer. The good news is we got it early. And I remember just shouting, take them off.
Breast cancer is the most common and deadliest cancer in Nigeria today. Cases have risen exponentially over the last 10 to 20 years. There's an urgent need for awareness and early detection. But why is breast cancer so prevalent, and what measures are being taken to address this issue? My quest for understanding begins at Lakeshore Cancer Center, a leading cancer facility in Nigeria.
Breast cancer is definitely the most common, most prevalent cancer in Nigeria. I would say a good 25% of all cancers in Nigeria are breast cancer. So it's a big problem. When you talk about breast cancer, you have a combination of different therapies. You have surgery, you have chemotherapy, you have radiotherapy. The biggest lack we have is in radiotherapy, right? So a country of over 200 million people, we're supposed to have over 200 machines according to WHO recommendations. In the country now, we definitely have probably less than 15. So that tells you the gap that we have. And even some insurance coverage might not even include cancer care. So that's a big challenge. One of the things we emphasize is that the diagnosis of cancer is not a death sentence, is still quite treatable. Early detection is key. Sometimes, especially with breast cancer, if you detect it early, it's curable and at a less cost.
Early detection saves lives. Equally important is the availability of quality hospice care, which is often overlooked in discussions about cancer treatment.
I think often when doctors train, we have this misguided view that we're going to be heroes that save the day always. And so when we face a situation where a patient isn't responding to treatment the way we'd like them to, it can be very difficult for us to deal with. But I think if we provide appropriate hospice, end-of-life palliative care, that's just as important as trying to treat the cancer itself. It is just as important to allow the patient to have a dignified passing as it is to try and rescue them from the cancer in the first place.
Health experts recommend that women over the age of 40 get annual screenings.
Mammograms are very important because it's actually the gold standard for breast screening. It helps to detect any lesion, abnormality in the breast early, before you even feel anything, or when you have felt something. Mammogram helps to check any lesion in the breast.
What about breast cancer in men, which is not spoken about enough?
Yes, you are very correct. Breast cancer is not only limited to women, although 99% of breast cancer occurs in women, but we still have about 1% of breast cancer that can occur in men.
While cancer care in Nigeria is improving, significant challenges remain, such as many hospitals facing shortages of essential technology. The NSIA Luth Cancer Center, a partnership between the Nigeria Sovereign Investment Authority and Lagos University Teaching Hospital, is one center pushing for quality oncological care, seeking to reverse medical tourism by providing top standard cancer treatment here in Nigeria.
The goal is to be the leading cancer center in Africa, and the whole mission of the enterprise is to ensure that we deliver care that is based on the deployment of technology, skill, and research. So delivering cutting-edge care, the same thing that the average Nigerian would travel abroad and spend thousands of dollars or thousands of pounds on, you can actually get it right at home. We started in 2019 with an investment from the Nigerian Sovereign Investment Authority, and in conjunction with LUTSO, it functions as a public-private sector partnership. We've been, over the last 5 years, able to treat a little over 10,000 unique patients.
Unfortunately, cancer rates are rising globally, driven by factors such as increased life expectancy, lifestyle changes, and environmental influences.
I had a left mastectomy. I have one breast, the left is fake. I did chemotherapy and I had radiation, and thankful for the gift of good people. People came out, people that I didn't even know from Adam. They came out, they donated, they supported me.
The people that rose up for me were strangers, total strangers, and some of my friends, my secondary school friends. They were the only ones I saw then. My family wasn't there for me.
I find that there's donor fatigue. And that applies to all the cancers. You know, have cancer months for every cancer. I find that there's so much bombardment, so much focus on screen. And I always say, okay, what happens when you find? I know so many people who have gone for free screening and then they're told that they have cancer and they are told, go and treat yourself. And I think that is shameful.
It is essential for Nigeria to keep investing in quality care through both the private and public sectors. Layla Johnson Salami, Arise News.